So what we do is, if the tooth's fractured, as I said before, we build it up with either composite or wax to what the ideal should be. Then we take the impression. I prefer the triple tray because the triple tray obviously gives you occlusion. When they bite into the triple tray, you're getting an impression of the maxillary and the mandibular teeth, and you get them in the proper occlusion. So when we reseat that with the acrylic in place, I know I'm getting very, very close to what I want from the patient's ideal occlusion. When the material sets, and it doesn't take very long for these alginate substitutes to set, we take a look, once again under magnification, we take a look at the impression to see if there's any voids or problems, pulls, whatever. And if everything looks good, we try it back in, make sure we can reseat it, and then we set it aside. And at that point in time, this is all done by my auxiliaries, at this point in time that I'm going to come in, take a quick look at the material and make sure that I like what we're seeing from a preoperative standpoint, and then we're going to prep. So we're going to complete the preparation. Once again, after we're done, before we actually start making the temp, we're going to take them that triple tray, and we're going to reseat it again and just make sure that it goes to place. I'm a big belt and suspenders, measure twice, cut once kind of person, so I just want to make sure that we're not going to have any problems with getting it to seat again. Then you'll take air water syringe and air dry the impression, get it nice and dry, and then take the gun and immerse the tip down into the tooth, and you express the Structur 3 material. Make sure you keep that tip in the material, because keeping the tip in the material reduces the incidence of bubbles, and you don't want bubbles, defects, voids in that temporary. Obviously, that just slows the process down. So what you want to do is express that in there. I like to literally fill the preoperative impression. That causes some flash that I'm going to take off, but I'd rather have too much than too little, okay? So you've got 30 seconds to get this material into the impression before you seat it, and then once you got the prep filled with the Structur 3, then you seat it just like you did before. And once again, this is why we've seated it multiple times, just to make sure that we know exactly how it goes to place.